Hey everyone. Get myself together. Hopefully y'all can hear me. I have AirPods in. All right, so first and foremost, Happy New Year. Happy Wednesday, first Wednesday of the new year. If you don't know already, my name is Monique, pronouns she, her, hers. And I am the community health coordinator here at Whitman-Walker Health. Some housekeeping stuff before I jump into what the live is about. So give me a chance. All right, housekeeping. Free HIV and STI testing by appointment only. We are still doing appointment only. Unfortunately, you cannot walk in, so the number to call is 202-797-4439. Again, that number is 202-797-4439 to make an appointment for HIV and STI testing. All right, read my little spiel. Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinant of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So, did my little spiel. I will not be talking about COVID today. I think we have had enough of that. Yeah, I think we've had enough of, hey, Ramisha, look at you. I think we've had enough of the COVID speak. And I know cases are high at the moment. But today we started a series actually at the end of last year called STD Talk. I think we did chlamydia and gonorrhea and herpes last time. So today we are going to talk about trich. So again, Happy New Year. Oop, I'm waving to y'all. Hey, y'all. So again, Happy New Year. Hope that everyone came into the new year feeling good and getting tested to know their status, whether that be HIV, STI, or COVID. We are continuing our mini-series, STD Talk. Sorry, y'all. Sorry. We're continuing our mini-series STD Talk, and today we're talking about trichomoniasis, okay? I know some folks have probably heard of it. Some folks probably haven't. Either way, that's what we're talking about today. As always, I do my lives. I try to do lives that like young people or people in general who come in to get tested have questions about. We already talked about two of the most common STIs, which are chlamydia and gonorrhea. So now today we are talking about trich, which is another very, very common STI. So trichomoniasis or trich. So if I say trich, that's what I'm talking about. It's caused by a parasite, and all those symptoms vary. Most people who have trich cannot tell that they're infected, right? Trich is one of the most common but curable STIs. I have some stats for you here. In the U.S., the CDC estimates that there were more than 2 million trich infections in 2018. However, only 30% of that number developed any symptoms. So, infection is also more common in women than in men, and older women are more likely to contract trich than younger women. So I know that like everything else is like usually younger people, chlamydia and gonorrhea, definitely affect younger people. But trich tends to affect older women more likely than younger women, and just women in general more than men. So how do people get trich? So the parasite is passed from an infected person to a person who isn't infected during sex. In women, the most commonly infected part of the body is the lower genital tract. So that's the vulva, the vagina, and the cervix. In men, it's mostly the part inside the penis, so the urethra, during sex. The parasite usually spreads from a penis to a vagina, or from a vagina to penis. It can also spread from vagina to vagina. It is not common for the parasite to infect other body parts, like, the hands, mouth, anus, which is like syphilis. So it is not common for Trich to do that. In infected people without symptoms, they absolutely can still pass the infection. Just like with herpes, even if you're not having a breakout, you can still pass herpes. What are the signs and symptoms for Trich? So about 70%, of infected people do not have any symptoms. Same as with chlamydia, gonorrhea, and herpes, honestly. When Trich does cause symptoms, they can range from mild irritation to severe inflammation. Some people with symptoms get them within 5 to 28 days after being infected. Others do not develop symptoms until much, much later. And symptoms can come and go. So Trich in men looks like itching or irritation in the penis, burning after urination or ejaculation, and discharge from the penis. So that, and remember, discharge from the penis also comes with gonorrhea as well. In women, Trich looks like itching, burning, redness or soreness in the genitals, discomfort with urination, and a change in vaginal discharge. And remember that women have discharge naturally, so it's important to know what your discharge looks like. You should be checking it out so you know when something ain't right, or something don't smell right, that you need to go to your primary care physician. So change in discharge could either be thin discharge or increased volume, that can be clear, white, yellow, greenish, or have a fishy odor. Oh yes, having Trich can also make it very unpleasant, also known as painful, to have sex, and without treatment, the infection can last for months or even years. So it's important that you get tested and receive treatment. What are the complications of Trich? So Trich can increase the risk of getting or spreading other sexually transmitted infections, just like with chlamydia and gonorrhea. So for example, Trich can cause genital inflammation that make it easier to get infected with HIV or to pass the HIV virus on to another partner. How is Trich diagnosed? So it's not possible to diagnose Trich just on symptoms alone, because remember, I gave you that statistic that of the infection cases that they had in 2018, only 30% got symptoms. So majority of folks will not have symptoms. So it's not, you can't just diagnose Trich based off symptoms alone. So for both men and women, you have to go to your PCP, your primary care provider, and get examined, and then you get a lab test done to diagnose Trich. We do not test for trichomoniasis here at Whitman-Walker Health. We only test for chlamydia, gonorrhea, and syphilis. We will do herpes testing only if you have symptoms, because 99.9999999% of us have come into contact with herpes one way or the other, whether it's a cold sore or in your genital area, you have come in contact with herpes. So unless you're having a symptoms, we wouldn't test you for herpes. So again, Trich is something that we don't routinely test for. If you do want, if someone has contacted you and say that, hey, I tested positive for Trich, even though we don't test for Trich, you can go to DC Health and Wellness Center, 77 P Street Northeast. That is on the red line if you're taking Metro. They test for Trich. Right now, I know that they have been exclusive to DC residents, so that they are priority. So if not, you can contact if you live in Maryland, you can contact your local health department and see if you can find a clinic to go in to get tested for trick. So yes, trick can be treated. What is the treatment for trick? So trick can be treated with medication by a doctor. These pills are taken by mouth. And if you happen to be pregnant or know somebody who's pregnant and they have been positive for trick, the medication is also safe for them to take. People who, as with any STI, people who have been treated for trick can absolutely get it again if you have sex with someone who is infected. About 1 in 5 people get reinfected within 3 months after having treatment. So of course, to avoid getting reinfected, all of your sex partners, you need to be honest, be upfront, be clear. All of your sex partners need to be tested and treated before you have sex, because they can reinfect you, or if they have been treated, you can reinfect them afterwards. So, and yes, another big thing, please do not share medication, because you have to take the entire course of medication for it to go away. So you can't I'm gonna take if it's 5 pills, I'm gonna take 2.5. You give your partner 2.5. Not gonna work like that. So if they need the medication, they can absolutely come in with you to get medication, or you can let the clinic know. So like the DC Health and Wellness Clinic, you can let them know, and they will do expedited partner therapy. So they will actually reach out to the partner for you, and they won't disclose your name. They can reach out to the partner for you and tell the partner to either come in and get tested or come in to receive treatment, because they have been in contact with someone who is positive. All right, so of course you wait until you finish the whole regimen of medication to have sex. We usually say 7 days, so about a week. Wait again to have sex. Then you make sure you get tested every 3 months. That is what we recommend here at Whitman-Walker Health in terms of STIs, is to get tested every 3 months. If you start to have symptoms before the 3 months, absolutely come in before then and get tested again. Won't hurt. How can trichomoniasis be prevented? Now, we already know the only way to not get or not contract an STI is to not have sex, not have sex, period. So we already know that. But if you are sexually active, you can do a number of things to lower your chances of getting trick, or any STI for that matter. Monogamous relationship, and that's monogamy on your part and your partner's part. And also talking with your partner and getting tested together. I think I think getting tested together is actually a dope date, or it could be the start of a date, and then whatever transitions after that, but at least y'all know where y'all stand initially from the beginning. So make sure y'all get tested together, or even if you don't get tested together, be upfront and honest and share your results. The one thing you don't want to do is take away another person's decision, because you wouldn't want somebody to take away your decision. So make sure you be upfront and honest. Use condoms, of course, every time you have sex. Use them the correct way. That can lower your chance of getting trick or anything. And yeah, another approach, which I was just saying, is to talk about the potential risk of STIs before you have sex with a new partner. The way that you make informed decisions about the level of risk you're comfortable with, taking in your sex life. And that's about it. If anybody has any questions, go ahead and drop them in the chat. Or if anybody has, any STIs that they want to know more about, heard about it once or twice, and don't actually know what it is, what the symptoms look like, how it gets treated, if it can be treated, drop those in the comment section, or after I post this video, you can drop it in the comment section underneath the post. But yeah, that's it about trick. see if there are any questions. While I'm waiting for questions, let me do my outro spiel. Excuse me. So that we can wrap this up after I get any questions. So, of course, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine. And actually, it just got approved literally like last week, Thursday or Friday, for ages 5 and up. So actually, everyone ages 5 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone 16 and up are eligible to receive a vaccine, period. So that's also Johnson & Johnson and Moderna gets counted in that. Please reach out to us if you would like to be vaccinated, 202-207-24. The phone line has been blowing up. There are only so many people who are here to answer, and we just came off of holidays, so folks have been on vacation, so bear with us as we get back into the swing of things. We will be answering your calls. There is a voicemail box attached to that phone number to make an appointment for HIV testing. You can absolutely leave a voicemail. We check it every day, so we will get back to you and schedule you as soon as possible. So don't stop trying to reach out to get an appointment for HIV and STI testing, okay? For DC residents, in terms of COVID vaccine, you can find information on vaccine walk-up locations and eligibility on vaccinate.dc.gov. The booster also for Pfizer is now, you're not eligible. So just go ahead on vaccinate.dc.gov to check that out and see where you can go. Most pharmacies, so CVS, Walgreens, Rite Aid, if a Rite Aid is near you, most pharmacies, also the Pharmacy and Giant, Pharmacy and Safeway, things like that, they have them in stock. And I think people, especially the pharmacies within the supermarket, I think people sleep on them or don't even think about them in their search when they're looking for vaccines, booster, or your first dose or whatever, wherever you are. I think people sleep on them. They have, and they are in stock, okay? So check out your pharmacies in the grocery store, your local grocery store, Giant, Safeway. And yes, that is it. I didn't see any questions pop up, so we're going to end it here. Again, I'm going to post this live, right in my stories, so you can, if you have any questions about any STIs, even the ones that I've already done, herpes, chlamydia, gonorrhea, and now today trich, go ahead and drop them there, and I will answer them next week, Wednesday, same time, same place. All right, have a good one.